Hello and welcome to Health Matters on Channels Television. We're so glad you could join us. I am Mary Alale Yusuf. Hepatitis is an inflammation of the liver that is caused by a variety of infectious viruses and non-infectious agents. According to the World Health Organization, about 254 million people all over the world live with hepatitis B and about 50 million with hepatitis C, but most of them are not treating the condition. In fact, more lives are being lost to viral hepatitis, with 1.3 million deaths in 2022 compared to 1.1 million it claimed in 2019. The disease is now the second leading infectious cause of death globally, behind tuberculosis. In spite of better tools and cheaper product prices, rates of diagnosis and treatment have stalled. Yet, WHO's global hepatitis strategy, endorsed by all member states, aims to reduce new hepatitis infections by 90% and deaths by 65% between 2016 and 2030. My guest is the Chief Consultant Epidemiologist, Department of Public Health, Federal Ministry of Health, Abuja. Dr. Jamiu Ganiyu is in the studio with me. You're welcome to the show.
Thank you very much.
I'm curious about why are people not getting diagnosis and treatment? Is it because the disease has no symptoms?
Not that the disease does not have symptoms. The challenge has to do with the cost of treatment. Despite the fact diagnosis and treatment, despite the fact that there be significant reduction in pricing for diagnosis and treatment, you're still looking at the poverty rate in the country. And I would like to say hepatitis is like an orphan at the moment in terms of...
Really?
Yeah, in terms of support. Until hepatitis get the same support as HIV/AIDS, without that, people still continue to have issue because everything is about out-of-pocket expenses.
But isn't it true that some medications used for HIV are used also for hepatitis?
Yes, especially for that of hepatitis B.
So two birds, one stone.
But the challenge is that the program for for HIV/AIDS actually focus on those people that are living with HIV/AIDS. So
Okay.
the challenge is that
so a person with hepatitis but without HIV,
yeah,
is at the losing end of this stick.
Because there is no provision for that, and that is why there will be a lot of advocacy, both globally and locally, to see how such kind of people can also benefit from one or two programs that are related to free or subsidized diagnosis and treatment.
What is the mode of transmission of viral hepatitis?
Okay, especially B and C is similar to that of HIV/AIDS, through mother to child. That is, if an infected mother has hepatitis, there is a 90% chance of that baby getting infected. Then through unprotected sexual intercourse, also through transfusion of unscreened blood. That's another thing. And another point is sharing of needles and syringes and other sharps. Like for those people, for instance, those people that are intravenous drug users, they need to share syringes, so they are likely of that. The healthcare worker too, through accidental needle stick injury, can also that. Then there are also some socio-cultural practices, like for instance, all those birthmarks, tattooing, local circumcision, ovulectomy, all those...
Ovulectomy?
Yeah, some people still...
Local ovulectomy?
Even medically, there is nothing like that. So people still practice that, removing the ovula, those are some of the common risk factors, especially in our setting, that are actually influence the increase in transmission. And that's why we're having a lot of cases.
You said so many interesting things. It brings so many things to mind.
Yeah.
In mentioning the modes of transmission, it sounds so much like HIV.
Exactly.
If I wasn't sure we were talking about hepatitis, I'd be thinking, oh, HIV.
Yeah.
But HIV, in the treatment and management of HIV, there's something called prevention of mother-to-child transmission,
Yeah.
whereby a mom does not have to pass it on to her baby
Exactly.
because of some sort of barrier treatment
Yeah.
that she's using. Don't we have that?
We have that for hepatitis,
B?
especially for B. You know, one thing is that B can be diagnosed and is treatable, where C is curable.
Okay.
So for mother to child, there are prophylaxis we give mother from 28 weeks of, I don't want to, so that people, from 28 weeks of gestation, we give them certain kind of drugs. And at the same time, we ensure that the birth is uneventful, meaning that such birth should not be associated with any injury, maybe that will warrant mother blood or secretion mixed with that of the newborn baby. Then one critical thing which we are really emphasizing is the issue of birth dose. That is, a newborn baby
You
should
give him something
within 24 hours of birth. Within 24 hours of birth, that child must be given hepatitis B vaccine.
Okay.
So, yes.
So let me ask you another question.
Yes.
Is it customary to check pregnant women for hepatitis B?
Yeah.
To make sure this thing is not passed on?
Yeah, it has been adapted in the country. There's what we call triple elimination approach, in which when every pregnant woman that is assessed antenatal care will be actually they will be tested for HIV, syphilis, and hepatitis.
When did this start?
It's recent through some support from Global Fund and other. And there are some states that have actually adapted that. I'm aware of Delta states and some few other states. So, but nationally, we have what you call the aspect of triple elimination approach, which I just mentioned. But some states, through advocacy, have also adapted such a process so that mothers can be screened for the 3 diseases, and those ones that are maybe found to be infected with B can then be commenced with prophylaxis during pregnancy.
It seems to me, you know, that a lot of people do not understand viral hepatitis because the same conditions which exist in HIV exist in viral hepatitis. The modes of transmission are similar, yet if somebody says, you know, I'm HIV positive, everybody scatters all over the room. But if you say, oh, I have hepatitis B, they're like, so?
Yeah, because you know, in hepatitis, there's what's called acute hepatitis and that's called chronic. Some people, especially, they may have the acute type and they will recover from it.
Okay.
Usually last between the period of infection to like 3 months. So some people, especially adults who have developed immunity, they have that ability to kind of recover from it, develop immunity against that. That is why.
Do they have recurring infections?
No, not certain. If the core thing is that they're able to develop an antibody to that, antibody to the hepatitis surface antigen. So it's a lifelong protection against that.
The picture is somewhat different from HIV.
It's quite different. It
looks friendlier,
exactly,
so to speak.
It's not really friendly.
No, not. Just the look of it.
Look of it, but it's not. Yeah, it's not.
Okay, so WHO is speaking of better tools for testing, diagnosis, and treatment. What are these better tools?
Yeah,
and do we have them?
We have them. We have them. What they are trying to say is that something that is innovative. For instance, there is what you call gene expert machine.
Okay.
It's being used for diagnosis of TB, especially those that develop
COVID too.
COVID, yes, because
it was during COVID.
Exactly.
I got to know about this gene expert thing.
So it has also can be used for diagnosis of viral, especially viral load.
Okay.
You know, the first treatment, the first testing for hepatitis is use of rapid test kit, just like the HIV. So if somebody started to have, especially for B, hepatitis surface antigen, then the person will now be with there are other tests we do that involve some antibody, whatever. But the gold standard that differentiates from that of HIV is the fact that they need to undergo viral load testing using polymerase chain reaction, on which this gene expert machine has the ability to do that. As long as there are what we call cartridges, as long as we are able to use appropriate cartridges for that, they can be. And if during testing, and the machine is able to pick hepatitis B DNA. That's called DNA. That person is confirmed to be positive for hepatitis B, and there are also criteria to know whether that person will be on treatment. The beauty of hepatitis B is the fact that it's one drug regimen.
Okay.
I use TDF. I don't want to mention so that people not go and they will not be
Looking
practicing
for it.
So, but either you use TDF, and we have other like TAV and so on. But for C is, I use the word curable.
Yes.
Apart from using the rapid test kit, just similar to that of B, we also do viral load testing. And if you're able to pick hepatitis C RNA, that is a confirmatory test.
That
and
the person does have hepatitis
so that person will now be screened, they're eligible for treatment. And for C, it is curable. 3 months course without any, if there is no any complication, that person can achieve cure after 3 months.
Okay.
For hepatitis C.
So the cost is the issue.
Is the issue, because looking at, for instance, the rapid test kits at the moment is not quite too expensive, maybe 2,000. You know, with this dollar exchange rate, that's what is making it a bit.
Change.
If not, it's not as expensive before. Then even for the viral load testing, usually before. You can have it in the range of 50 to 80,000, depending on the facility. Then for the treatment, especially if you are talking due to series of engagement, there are some partners that have contributed to advocacy, pool procurement. They'll be able to bring the prices of some of these drugs down. You can, with $60, somebody can get complete treatment for hepatitis C. Yeah.
But is it still true that every child, every baby who comes for the vaccination program, the Nigerian vaccination program, is eligible for the hepatitis B vaccine free of charge?
Free of charge, free.
Full coverage.
Yes, that of bad dose is called the monovalent that you give within 24 hours.
Within 24 hours?
We need to specify that.
Please,
because that's
tell us. Because
within 24 hours.
I gave them to my children.
Yes.
But they were like 6 months old then.
No. This is how it is. After the monovalent one, which is given, we call it bad dose. But that bad dose means it's within 24 hours.
Within 24 hours of birth. One shot.
Then the other course, 6 weeks, you give it with other, we call it pentavalent vaccine.
Yes.
We mix with that of other like diphtheria, tetanus, and so on. So we call it five vaccine in one. So hepatitis is inclusive in that. Then you repeat after 10 weeks. Then we do that after 14 weeks. So
even better than before.
Yes. So
we've got to go on a short break.
Thank you very much.
Please stay with us. We're going on a short break. Welcome back. This is Health Matters on Channels Television, and we're talking about action against hepatitis, viral hepatitis. If you have a question on viral hepatitis, please call 0808-054-2233 or send a message on X at CTV_Mary A, or send me email to moalale@channelstv.com in the course of the program. Let's continue from where we stopped. You know, WHO says about the burden is carried by about 12% of children. And 12%. Nigeria was mentioned as one of the nations contributing to 2/3, I mean, with other countries, of the hepatitis burden. But here you are saying within 24 hours. What is going wrong?
Okay, I think the current, we need to actually move from the current practice, because in some health centers, they normally fix a particular day for different vaccine.
Okay.
They will say Tuesday, some say Wednesday, and so on. So what we're advocating now is that there should be a kind of policy change in such a way that there should be availability of hepatitis B vaccine in all labor and delivery wards.
At all times?
At all times, so that you just...
So you will net more children in.
Exactly. Because some children are delivered by weekend. So meaning that they need to wait maybe during weekdays, and that has been a major
And
challenge.
sometimes the parents don't come back.
They will not come back. Some don't come back. So I think the better approach is to have a policy that emphasizes on the need to have hepatitis B vaccine in all labor and delivery. So as
But can
those
they
children
also go to their houses?
It's
The way
still-
they did with polio.
Yeah.
You know, you had 5 babies over the weekend,
Yeah.
and they've gone home. Can't they just go around and,
No, what we are trying to do, there is what we call the traditional birth attendants. Some people delivered in all these birth delivery homes. Some of these TBAs are in the
Yes,
community.
yes.
So what we are trying to do, which I think many state government are trying to do, is to actually collaborate with the TBAs, so that any child that is being delivered in such home,
yes,
clinic can,
so that you can get the numbers
exactly, they will just
together.
inform the.
Let me just pause you there and quickly
okay.
take this call from Olawale.
Okay.
Olawale in Ikorodu, what's your question? Are you there? I think we may have lost Olawale. Please try again. So you're trying to do this collaboration.
Yes, with
birth
TBAs.
attendants.
There'll be a lot of.
That's traditional birth attendants.
attendants.
Not everybody knows.
Yeah, so traditional birth attendants, those are people that are within the community where people prefer, because of the cost of cost of services is a bit cheaper. So some people prefer to go,
and it's homely.
It's homely, exactly. So I think the best thing is to, which I think many governments are trying to do, is to collaborate with them, so that anybody that delivers there, they'll inform the nearest primary care center, so that they can take the vaccine there
would help
and get such.
deal.
And again, that also approach to use community informants. What they do is that whenever there is any new delivery within the community, they will inform them. Then those people now inform the nearest health center, so that such kind of a child can have opportunity to have that 0 dose of hepatitis B within 24 hours.
Okay. We were talking about global figures,
Yes.
but can you give us a sense of what the situation is in Nigeria of hepatitis, of viral hepatitis?
For now in Nigeria, based on the last survey that was done with that of HIV in 2018, the prevalence of hepatitis B in Nigeria is 8.1. That of C is 1.1,
okay,
which means for the both about 20 million people that are living with hepatitis in Nigeria. As I've said, despite that we have
10% of the population.
Exactly. That's why the fact that we have a national program, but the funding has been a major challenge. Until we have free treatment, a program that take care of free treatment, diagnosis. I think it may not be for everybody, but maybe we start with a certain number, just like what we started when we started rolling out national HIV antiretroviral program for HIV in 2004.
Let's see if we can talk to Bolanle.
Okay.
Hello, Bolanle. Okay. You can try once more. Okay, so
what I'm saying is we need to have a national program that look at free treatment. Maybe.
But how soon is this going to be
Well, we
coordinated?
keep on with advocacy because for a few countries that have achieved some level of elimination in African country, it has to be issue of funding, a kind of national treatment program, diagnosis, like Egypt, Rwanda.
Okay.
They've done a lot regarding that. Egypt has been awarded, given a kind of award of recognition for achieving elimination for hepatitis C. And Rwanda is at the point of also achieving similar feats regarding elimination, because what they did in some of these countries was that they did what they call mass screening,
yes,
and so on, so treatment and so on. So because they were able to cover a lot, somebody may argue that yes, Nigeria is
bigger, has more people.
So what we've done, if you look at our guideline, we'll be able to prioritize some priority groups. So maybe we can start with them. Whether we like, even with the health workers, they are one of the high-risk groups. Yes, the prevalence is
because of needle stick
injuries and so on. So I think with proper funding, which we keep on advocating, I want to believe we will also one day get to that place. But for us to be able to achieve meaningful progress regarding diagnosis, treatment, there must be need for a large chunk of money to support the program.
Let's see if we can get this call from Victor in Taraba State. Hello, Victor.
Hello?
Yeah, we can hear you. What's your question?
My question is that I was diagnosed with hepatitis B since 2014. So we are put on drugs that time, particularly this tenofovir medication. We have been taking it like 2 to 3 years. We have been taking it. But the thing is that by that time they used to say that it's curable, it's curable. So we keep on taking the medication, but if you go to do the test, it's active. So I don't know. And today I'm hearing that that hepatitis B is not curable, but it only has a vaccine when you don't have it. So my question is, how are we going to do now? We that have it, is it that the virus is still active in our body or what?
Much, Victor, for that question. That's an excellent question. And let me just give it a bit more body by asking, how well can somebody live with the hepatitis B virus if he or she is being treated?
Yes.
Just add that to it.
Just like what I said, for now, it's only a very few people have been able to achieve cure. We have it
Some achieve cure
yes,
of hepatitis
B. Yes,
wow.
The surface antigen disappeared. That's what shows
Okay.
that they've achieved that.
Okay.
We have some centers like in Ife and so on, but when you look
More
at literature,
often than not,
it is only treatable for now.
Okay.
And I will advise him he should not give up, but because the gastroenterology are trying to prevent is the issue of damage to the liver.
Okay.
That's why they must be on treatment to prevent cirrhosis, and cirrhosis can give rise to liver cancer and so on.
That's
so
right.
I think he should continue with that. For now, it's only treatable, but it's not curable.
But he can live.
He can live, yeah. That's why I use the word treatable.
Life.
Yeah, very cool quality, very good quality of life. But he must continue to maintain that follow-up with the gastroenterologist, maintain the normal clinical visit and so on. I think that's for now. That's my advice for him for now. Yes.
Thank you so much.
Yes.
We've come to the end of the program. Can you believe it? Thank you so much for coming on the program. It was wonderful.
Thank you.
Thank you for being with us, and thank you for your wonderful question, Victor, and the courage to come out and help educate us. For every single one of you, have a wonderful day. I am Mary Alale Yusuf.